Hello, I'm Dr. Herman here. I'm with great patients who come to my clinic, great people, patients of mine who come to my clinic. This is Mr. and Mrs. Emerson. I did do a video several months ago. I think it might be September of 2017. Today is April 19th of 2018. And we did do a previous video together, you and me, Mrs. Emerson, about how you were improving at the time with your symptoms. But now we have even more improvement.
Yes.
I appreciate you both folks helping to share this with people out there who are suffering. The reason why we're doing this is to help people who are suffering out there with various conditions like yours. And one of your symptoms was that you were having such an elevated rapid heart rate, heart palpitations, heart rate elevated in different positions. I mean, you were lying down or standing or sitting. It could happen in any way, right?
Yeah.
Yeah?
Yes.
And you also had symptoms like tingling in the legs,
Yes.
and you had heaviness in the legs.
Mm-hmm.
You had a pressure in your chest.
Mm-hmm.
You had a heaviness in the chest.
Yeah.
You had fatigue.
Mm-hmm.
Yeah. You had anxiety as part of it.
Yeah.
Yeah. Were there many nights that just like you couldn't sleep, like lying down on your back or your side? You even said it was real difficult.
Yeah, it was very difficult, very uncomfortable.
Mr. Emerson, what was it like seeing your wife going through these problems, as well as, in addition, that question one, question two, when you went to different doctors with her, for her and with her, how did you feel when you were leaving and they just, I think from what I've heard from you both, that they had no answer, no reason why it was going on?
Yeah, well, I mean, seeing your partner kind of go through what she was going through is obviously hard and difficult. Both emotionally trying to be the support there, and then just physically trying to help her and accommodate her in any way that you can. And yeah, you touched on it, that going to other doctors and not getting answers, or at least pointed in the direction we needed to go, was pretty frustrating and stressful. So finding you and coming up upon this really kind of put us in a better situation, gave us a little bit of peace of mind and hope, more than anything, that we can begin moving in the direction we need to go in. So.
And between November of 2016, when this all started, to now, in April of 2018, what kind of difference have you noticed for your wife?
Significant difference, just leaps and bounds. She's more vibrant, feeling a lot better, eating a lot better, feeling better physically and emotionally. I think through the protocols have helped out a lot, and we feel like we're coming to a point to where we've kind of gotten back to where we need to be.
Normal to be feel and function normal again.
Yeah.
And you were already on the medications. You were taking a beta blocker. You're still taking it. You were taking it then, but when we first started, but you still had the heaviness in the legs.
Yes.
You still had the pins and needles in the legs.
Yes.
You still had the palpitations to
Yes.
some degree. You still had the heaviness in the chest with the medication.
Yeah.
You still had the pressure in the chest.
Mm-hmm.
You never really felt like that was completely alleviating the situation.
No,
Right?
it was just covering
Some of it up, but not all of the heart
Yeah.
palpitation or heart rate condition.
Yeah.
It wasn't covering it all up. And at this point now, you're able to, as you said, you're able to change your position and sleep on your side. You can
Yes.
wake up in the morning, sleep on your side, and that's not a problem for you anymore.
I go to sleep on my back and I'll wake up on my side.
And that was impossible before, because the
Yeah.
heart would start racing, pounding in the chest, and so
Mhm.
on. Yeah. The pins and needles now are completely gone in the legs.
Completely gone.
The heaviness in the legs is now completely gone.
Yes.
The pressure in the chest now. What's recent is that I had found with her, going back several months ago, back in probably about the middle part of 2017, that she had a couple of teeth. One of which, I think one of them was a root canal.
Root canal.
Or was the other one a
And
root
it
canal?
wasn't too.
It wasn't too.
It's
So
broken.
a broken tooth that was in the mouth, and she had a root canal that had a metal post in it. That was a crowned capped root canal tooth. That had to be removed. That just came out a couple of days ago, which is April 17th of 2018. Those came out. And when those were pulled, you felt now, because before then, you still had a coming and going of the pressure in the chest and the
pressure
heart
was
rate
still
situation.
coming down.
And now it's been
No pressure on the chest. No chest
Zero.
pressure.
not even coming and going. It's been,
17.
so far, it seems like 48
So
hours
far,
of complete
yeah.
alleviation of the heart pressure feeling.
Mhm.
In this round, I found with using her teeth that were extracted, I have those teeth here, those teeth in the infection went to the heart muscle, to the heart valves, to the aortic valve. It went to your liver. It went to your kidneys, the artery to the kidney, parts of the heart muscle, the ventricles, the bottom part of the bottom chambers of the heart muscle, the inner part of the heart called the endocardium. It's in all these different tissues. The mitral valve, it's on there. So these remedies in this round are going to clean those infections up from the heart tissues, from the portal vein that brings the blood to the liver, from the artery to the kidney, from the kidneys. Really spread around your body in a big way, and you didn't even know they were going there. You couldn't tell. It's not like you broke out in a fever and your stomach hurt, or your, you know, it's
Yeah.
you don't know. It's not like you've got some pus coming out of your mouth, and it's a silent infected tooth or two that were just the infections were going through the bloodstream from your jaw to parts of your body. Pretty scary, but great to know that we can find it and get rid of it, right?
Yeah.
So, and you also one more symptom you had, the shortness of breath, and that is totally.
Nothing so far since the 17th, when the chest pressure went away, the shortness of
Breath went away. And now you're at the point where you think either before you start this round or after this protocol that we're going to get into now, that you're going to start even dropping down the beta blocker medication on your own, weaning off of it and see where you are there.
Yes.
But you're feeling stronger. You're definitely stronger than you were when you first took that medication.
Oh yeah.
Much
Yes.
better.
Yes. Much
Awesome.
better.
So maybe at the end of this whole journey that we could sit together again and just say, I'm off the med, I feel great, it's real, it works.
Yes.
And
we will.
right now we're saying that it's real and it works.
No.
Yes.
But it's just, yeah.
Oh yeah.
Yeah, so, but
Yeah.
it's just, thank you. It's just getting to the end of it where you're off the med and we know that the med is not even playing any little tiny role in getting you to feel that better.
Yeah.
Yeah, so we're almost there. Awesome. Do you both think that this is something that's other people who are suffering with, whether they call it a POTS condition, a tachycardia problem, a heart, blood pressure, heart rate, some kind of chest pain, do you think other people should look into this with me?
They should. Yes, I think so.
Yeah, I would support it 100%. You know, I've already got people in mind who I want to kind of refer to. You know, but yeah, I think that a lot of good benefits will come from the service.
That's real?
Yeah.
Awesome. Thank you. You can call our clinic number at 954-370-3100. I will be putting up some other exam findings from her. They're not too personal, but I'll put up some of the findings, the unique findings I've discovered in these exams that were part of our protocol. And you'll be amazed when you hear these other kinds of exam findings that your doctors are not telling you when it comes to a POTS, a tachycardia, heart rate problem. You're going to hear some different things that you're not getting from a tilt table test or an EKG or a stress test. You're just not, from a blood test, you're not getting these answers. And you can call the number again, 954-370-3100, or send an email to my clinic assistant, who will, very happy, very sweet woman, who will help you schedule an appointment and make flight arrangements, so on, to come in. And for you, I'm sorry, you coming in from California, it's been pretty easy to follow this. You had to come back. Now it's 4 times in the past, let's say, year or so.
Yeah, about a
and
year.
your average return time, I mean, it's been like once every couple of months or a few months for you to come back.
Yes.
Yeah, so it's
About
not
3
so
months.
yeah, it's not so frequent coming in. It's been pretty easy.
Yeah.
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 All right. Thank you. Look forward to helping you too.